Hi guys, good morning. Welcome to another AMA session with Dr. Ben. I don't think for some reason my camera is not. Oh, here we go. Perfect. This is great, guys. Here we go. Easy fixing, Francesca. Jay, didn't we close the door? Oh, yeah, perfect. Okay, guys, welcome to another AMA session with Dr. Ben. I hope you guys had a great Thanksgiving. And the turkey was good. So, all right, guys. So today this is the winter session, the secrets of seasonal hair care to support hair growth. So welcome to another live session. Today we're going to review everything you need to know about hair growth, about winter hair growth myths, and how to support your hair growth during the cold winter months of LA. A quick disclaimer that this information is only for educational purposes and should not influence any medical decision making. Please reach out to your doctor to discuss the risk and benefits before you guys get started. So, true or false? Temperature changes causes hair loss. So, while it seems to be a common thought that hair growth is stunted during the winter months, there are no medical studies to suggest that hair growth changes completely during the winter months. It may slow a bit, but the main takeaway is that your hair is about your hair care routine. So, we're going to debunk this myth here and now. So what you can think about is instead, depending on where you live and what your environment is like, the temperature changes can have major effect on your body, metabolic rate, and it distributes nutrients to the hair follicles. Blood flow is the key because blood flow can change when extreme cold. So you might want to, you might basically want to see anything they could do to improve that blood flow to the hair follicles. So, for example, colder weather, basically less blood flow to certain basically areas as well, and that could basically kind of impact your hair growth. Um, Getting exercise and watching the abrupt changes from hot to cold, especially when you're in and out of cold in artificially heated environments, could affect the blood flow as well. So, another way you can improve and promote blood flow to your scalp during the winter is by using a scalp dermal roller. What a dermal roller is a roller that has about 540 spikes at the tip, and basically when you roll up and down, it kind of creates these micro channels in your scalp that increases that causes collagen stimulation, that also increases blood flow to the scalp, and that helps to repair weakened hair follicles by that increasing the blood flow and increasing the delivery of nutrients to the hair follicles. Now, cold air means less humidity and more moisture pull from your skin and hair. Artificial heating can cause hair strands to dry out and your skin too. So remember to keep your hair and scalp covered when you go out and add a moisturizer shampoo and conditioner that's free of sulfates to your routine. Replenishing the lost moisture is really important and it helps rebuild your strand strength through the elevated hair care ingredients. Um, as always, stay hydrated and invest in reusable water bottles with ounce markings to keep track of your water intake. Staying hydrated keeps your hair healthy. Remember that how much water you drink depends on your sex and weight. You can find many hydration calculators online so you know exactly how much to drink every day. Here's why staying hydrated is important during the winter months. It's not that you're losing water in sweat, but you're losing water by urinating, which happens basically when it's cooler out. Now, dry hair is weak and breaks easily. When your hair is dry, it breaks easily because you no longer have the elastic quality of a healthy, hydrated hair. You'll likely see shorter hair because it cannot grow to a length you like. Styling tips. Now, watch watch out for your styling and be careful to allow your hair to dry naturally because brushing or heat styling can actually damage your hair. Allow your hair to get as dry as you're able to reduce the stress from the hot tools. Now, remember, when your hair is wet, it's more vulnerable to breakage. Also, when sleeping, don't tie up your hair. Hair ties can pull on your hair follicles and cause breakage. Less sun, less vitamin D. So another factor during the winter, another basically factor that causes hair loss during the winter months is that our days are shorter and you're not getting as much sunshine as you did during the summer months. The less sun exposure you get, the less likely you are to get the correct levels of vitamin D, which is very important basically to support a good healthy hair. Here's what you can do. You can take supplements to replenish those vitamins that you need. At Happy Ed, we have formulated a hair growth solution, many of them with essential vitamin D of 2,000 IUs. It's recommended that is the recommended amount of vitamin D that you need in your diet to support strong, healthy hairs. Our super capsule contains about 2,000 IUs of vitamin D3, and we also have our Happy Ed multivitamin that also contains vitamin D3. Now, question and answer portion. Please, you could basically post your answer in the chat. The first person made to answer this question gets a free thickening shampoo and conditioner. True or false? Does your hair grow less during the winter months? Francesca here will choose an answer. Will choose a winner basically from people that respond in chat. Okay, now we're gonna move over to some of the Q and A that our patients have asked. Okay, so I've been using the Happy Head for about 8 months with amazing results. So we're very happy. Um, I have a thin spot on crown I would like to fill in. Is the zero point 0.3 dutasteride formula stronger than a kitchen sink? So the kitchen sink, so that's a good question. So the kitchen contains both finasteride, dutasteride, minoxidil, all combined to one, whereas the zero point 0.3 dutasteride is usually the zero point 0.3 dutasteride with minoxidil. Technically, the kitchen sink could be a little stronger, but it really depends how you respond. So I probably would start with a zero point 0.3 dutasteride and then move over to the kitchen sink.
How about for the next portion, you can talk about our shampoo and conditioner, give some tips on how to style,
Perfect.
ingredients.
Great. So basically, so let's go through the happiest shampoo and conditioner. So happiest shampoo, basically, we developed both the shampoos and conditioners. We actually reviewed many of the hair conditioners out there and hair shampoos out there, and we reviewed like a lot of the clinical studies, and we want to see which ingredients in those studies really outshine all the other ingredients and showed clinically effectiveness in causing hair growth. So, it's a couple of things basically that kept appearing in those studies. One of them was collagen. We realized that when you add collagen to shampoo, kind of making like a collagen shampoo, it really allows for the hair to grow healthier and to have much more vibrant looking hair. So we added collagen to our shampoo. Also, we added biotin and argan oil, and more importantly, we combined it with saw palmetto along with keratin. And both our regular shampoo and conditioner basically has that. One of the important reasons why you need a conditioner is because, as I said earlier, when your hair is dry, basically, and brittle, it's more likely to break. So you need that conditioner basically to kind of moisturize the hair and makes it less dry. And as a result, basically, it is not going to get as damaged as easily and basically break in half. So that's where the conditioner is basically really important. And also, a lot of the some of the happy products could also make your scalp irritated, like the topical solution. So using a conditioner is important because it reduces some of that irritation. Now, is hair loss hereditary? Hair loss is genetics. So when somebody comes to the clinic and basically have hair loss, one of the important things that we ask them is, look, how does your mom look and how does your dad look? Hair loss is genetics, and that's one of the major reasons why people lose their hair. So I have patients that come in and both the mom and dad basically the dad is bald, grandpa is bald, and mom is losing a lot of hair. Unfortunately, that patient is more likely to experience hair loss sometime in his lifetime. Now, I also have patients that mom is hair looks great, dad hair looks great, no one in the family is bald, but they're still losing hair. How is that possible? Well, it's possible that the mom and dad they both had a recessive hair gene, and both of those genes came together basically in our patient. So now they carry both genes, and now they're susceptible to losing the hair. And also, hair loss it's has many different factors as well. Is your stress, your diet, what you eat, what you put on your hair, how you treat basically your hair, styling gels, how much heat you put into it. So a lot of those things basically also affect your hair loss as well. So it's just not single factor; it's multifactorial, and this is why a lot of happy products contain multiple active ingredients to address the multiple cause of hair loss. Um, how can I prevent hair loss? Well, that's a very good question. It really depends on where you are based in your life, and how aggressive the hairstyle is. So obviously, there's certain things that could negatively impact your hair. So for example, if you work out a lot and do a lot of creatine, that's very bad and it's horrible. If you do a lot of energy drinks, especially Red Bull, that's bad. Anabolic steroids, um, non-organic chicken, eating whey protein isolates. The reason why whey protein isolate is bad is because that's a powder shake that people usually use during workout, and that increases your testosterone level, and that could lead to more hydrotestosterone, testosterone, which leads to more miniature of your hair. So whey protein isolates are bad. The exact opposite, whey protein concentrates are actually really good. So isolates are bad, concentrates are good. Adding more testosterone to your diet is also bad as well. So those are the things that you want to avoid. And also, for example, being very aggressive with your hair, using a lot of hair gels, using hot oils on your scalp, or blow drying your hair at very high heat. All those basically will lead to more of your hair being damaged. Now, the things that are good for your hair is, for example, like for the not shampooing every, like shampooing every 2 or 3 days, basically that's probably good. Using a scalp conditioner, that's great to moisturize your hair. um, Eating a well balanced diet, eating a lot of protein in your diet, adding collagen to your diet, and also vitamins like vitamin D, like B6 and B12. Those are also really important, especially menstruating females. Adding iron to your diet, those are also really important. Um, at what age does hair loss start? It usually, everyone's different. If you're genetically predisposed to losing your hair, um, you're going to basically obviously lose your hair earlier. And then if you go through certain triggers, you're going to lose your hair even at the earlier stage. So let's say you're genetically predisposed to losing hair, and then you go through like a really bad breakup, or you lose like a lot of weight rapidly, like you lose 30 pounds in 2 months. Those stressors will trigger more hair loss, which means that they're going to accelerate your genetic predisposition to underlying hair loss, and you're going to start to lose your hair more and faster. What is alopecia areata? Alopecia areata is a certain form of autoimmune hair loss where the body attacks the hair follicles and creates patches of hair loss throughout the scalp. And it's different from androgenic alopecia, because androgenic alopecia, which means male or female pattern hair loss, it's not an autoimmune condition. It's a genetic condition, where stress and environment basically accelerate that underlying genetic predisposition. But with the alopecia areata is autoimmune, something does trigger it. Once it's triggered, you get these basic bald patches everywhere. In fact, I have alopecia areata. The typical treatments that we do for androgenic alopecia does not really apply to alopecia areata. The standard of care is to inject it with cortisone to make the hair come back. Now, cortisone injections does not work for regular hair loss. Now, can excessive hair styling cause hair loss? Absolutely. The problem with excessive hairstyling is that the hot oils and the heat could damage your hair by making it dry and brittle. So this is why we recommend not to do any excessive hairstyling. We even have patients who've done like keratin treatments, and literally they've gone through major excessive shedding, and their hair may never come back. How does male pattern hair loss progress over time? So usually with guys, patients lose the hair starting from the widow's peak, and they start to thin out a little bit, basically in the crown area. As time goes by, what happens that the hair is miniaturized, and you literally lose those hairs. So basically, the hairline keeps going back further, 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 and the bald spot keeps basically getting bigger and bigger and bigger. At Happy Head, we have customizable solutions, both topical and oral, that could help prevent the miniaturization of hair. There are usually many different causes of hair loss, usually DHT, which is dihydrotestosterone, that causes miniaturization, and also is the lack of blood flow to your hair that also induces more hair loss. So with a lot of our medications combined with finasteride and minoxidil together topically. Finasteride is a testosterone blocker, which means that prevents your testosterone from coming to DHT, and by doing so, since you don't have the DHT, it prevents the miniaturization. Minoxidil increases blood flow to your hair, and by increasing blood flow, basically it washes away the DHT, and it brings nutrients and oxygen, which allows for better, just more nutrients to the hair, and it allows for better hair growth. When we combine both of these together, we are targeting two other different causes of hair loss, which allow you to have basically better hair and prevent initial miniaturization and cause more hair growth. Um, is it safe to use Happy Head after hair transplant? Yes, absolutely. We have a lot of patients that after hair transplant use Happy Head. The reason is because when you do hair transplant, your other hairs are still susceptible to to miniaturization and being lost. So using Happy Head, finasteride, and minoxidil will strengthen the rest of your other hairs and actually reduces your chance of getting another hair transplant soon. If I'm experiencing hair loss, what um, should be considered normal numbers of hair fall? So um, people could lose about 50 to 100 hairs on a daily basis. Um, and if you, and because that's actually normal amount of hair loss. Now, if you experience more than 100 hairs a day, then you're gonna basically end up thinning out, and that's when you want to go on oral topical happy head medications to prevent that additional hair loss. Um, does the Dalton size of the topical finasteride pose an issue with absorption? Or does the retinoic acid assist with absorption of finasteride? So we know retinoic acid basically increase absorption of other ingredients, specifically minoxidil. So the topical dutasteride, you're right, is a much bigger size. It's still basically the benefit of topical dutasteride is this. So it's a much bigger molecule. It still gets absorbed locally in the area, but it since a bigger Dalton, the theory is that it doesn't get absorbed into the bloodstream, thus having lower risk of sexual side effects. For tension, alopecia, would a long-term treatment like minoxidil still work? Yes. With people that get like tension headaches, what happens is that your muscle tenses up, and by it tenses up, basically it constricts the blood vessels and it prevents the blood flow to the scalp. When you do something like minoxidil, it actually it's a vasodilator, so it opens up those blood vessels and basically increases blood flow to the scalp, brings nutrients and washes away the DHT, so it can be very helpful for basic hair growth. Can you explain latanoprost and is it worth it? So latanoprost, the original Latanoprost formula is latisse. Latisse is a molecule that was originally basically discovered by a company called Allergan for is a blood pressure medication in the eye. So for high blood pressure medication for high blood pressure in the eye, known as glaucoma. They realized that it actually causes hair growth. Then Allergan came up with the Latisse product, which is a topical application where people put it on their eyebrows and eyelashes to cause hair growth. At Happy Head, we have also incorporated that ingredient into some of our topicals, combining it with finasteride and minoxidil, and to promote more hair loss, to promote more hair growth. So it does work, and it's a great molecule. And together with the other ones, it provides a good synergistic effect in reducing hair shedding and causing more hair growth. Is there any food in particular that can cause hair loss? Well, we already kind of talked about this. A lot of the whey protein isolate powders are bad because that's going to increase your testosterone level, which increases your DHT level, which could cause more hair loss. So that we recommend not to do. Energy drinks are bad, anabolic steroids, creatine, non-organic chicken, and obviously alcohol and smoking. They're all bad. How do you know if financial disaster will work better for me? There's no way you can know until you try it. So we typically usually start with finasteride, and then if that doesn't work, we typically recommend dutasteride. Dutasteride is an FDA-approved medication for enlarged prostate. It's used off-label for hair loss. There are some studies that show that dutasteride could actually work better than finasteride because it inhibits two enzymes as opposed to finasteride, which is inhibiting one enzyme. Also, studies have shown that it is also possible that dutasteride, for some reason, may have potentially lower risk of sexual side effects compared to um, finasteride, but more additional studies are needed to really evaluate that claim. Um, what is the efficacy of minoxidil over a long period of time? Is it still effective? Use it year after year? That's a very good question. So in studies have shown that actually, if you are responding to minoxidil, that could actually still be effective for like a long period of time. The problem is that not everyone is responsive to the 5% minoxidil over the counter. That's why Happy Ed, we have a higher concentration of 6% or 8%. What is the best formula to start out with? So the best formula to start out with is our standard formula, which is the finasteride 0.3% combined with a minoxidil 8%. That also is fortified with retinoic acid. That is the best formula. And we recommend using that about 4 to 6 months. Now, let's say if that doesn't work, then we could always switch you to the dutasteride formula. Or if you have any side effects from like irritation, then we could customize it and reduce the minoxidil or the retinoic acid to reduce some of that irritation as well. We'll happy to offer more volume of the of the topical medication in a bigger bottle. That's a great question. As of right now, the 60 ml bottle is basically is the biggest we have. The reason is because a lot of people actually would happy to do travel, so the bigger size actually would prevent them actually carrying it on the airplane. So that could be a problem. But you could buy them in bulk and you could get a discount. And I know if I just basically post the link right there.
Here.
Dermal roller. Guys, this is the Happy Dermal roller. So, and this is actually very important, especially when used with a topical Happy. Reason being is because, so when you do a dermal roller based on the scalp, the way you want to do it basically, first we recommend applying the topical solution on the scalp because by applying it, it makes it wet and it's just easier to roll, so you're not dragging out like a lot of your own hair follicles. So you basically roll back and forth really gently. Don't make yourself bleed. Don't add a lot of pressure to it. You go right and left, diagonally. And again, and this allows for better penetration because what it does is it creates microchannels and holds into the scalp, and that allows for the topical to penetrate deeper into the scalp. It also increases blood flow to your hair, which is great because it's bringing nutrients to the hair follicles and washing away some of the bad stuff, which is the DHT, and it also stimulates collagen production, basically, which is also important for your hair as well. So
How
this
many times a day?
I would typically recommend this once a day. The importance about the Happy Ed dermal roller is that it's a 0.25 dermal roller. I typically do not recommend using anything stronger than that. I think the 0.25 is perfectly fine. Again, do it once a day, every night, apply the topical, and just gently roll on top of it. Now, the question that's also people ask all the time is that what do I do if I get irritation on the scalp from using the Happy Head formula? There are many reasons why people get irritated. Number one, it's the minoxidil that could be irritating. So you could always reach out to us and we could reduce the concentration of the minoxidil from 8% to 6% or even lower or even take it out completely. Also, retinoic acid can also be irritating. The retinoic acid is incorporated into the formula to enhance the efficacy of the topical minoxidil. But again, if it's irritating, we could always take it out as well. Other things you could do is to use the leave-in conditioner. What a leave-in conditioner is that it's a conditioner that you apply to your scalp right before you leave the shower and you just leave it in. It actually helps to moisturize and hydrate your hair, and it reduces the irritation from the topical. Another easy trick that you could do is that when you apply the topical Happy Head, you could actually wash it off after 2 hours. So you could apply it at 8 o'clock at night or whatever, 7, and wash it off by 9 p.m. You're still gonna get very good effective results from it, but it's not sitting on your scalp all night, so it's gonna cause less irritation. Also, instead of using it twice a day, you could use it once a day. You could also purchase special hair serums on Amazon and you apply basically onto the scalp, which are gonna be very soothing for your hair. And remember, Happy Ed is a customizable formula, which means if there's any questions or issues with it, please let us know and we'll be more than happy to switch it out for you. Now, with respect to the different type of formulas, at Happy Head, we have topical finasteride and we also have topical dutasteride. We also have oral finasteride and we have oral dutasteride. The benefits of dutasteride or finasteride is as follows. Dutasteride inhibits both two enzymes that are responsible for converting testosterone to DHT, whereas finasteride inhibits only one enzyme. According in clinical studies comparing dutasteride to finasteride, dutasteride was a superior molecule, and also we believe a Happy Head that it could also promote just better hair growth. Um, so if you're new to Happy Head and you don't know which one to get, probably start. I mean, although finasteride has is our top best-selling sellers. Uh, you may consider starting with dutasteride because it inhibits two enzymes, and patients could see better results over the long term, according to clinical studies. Also, there are some patients that don't like to apply topicals on their scalp for other reasons, and sometimes taking a pill is much easier. Because of that, we have introduced the Happiest Super Capsule. The Happiest Super Capsule combines three different ingredients all in one. It includes, let me see, finasteride. It also includes minoxidil, and it also includes vitamin D. The benefit of this that is three pills all in one. It streamlines basically the entire process, but that means you don't have to take three different pills. You just basically take one. So that's the benefit of the super capsule. And there are many different versions actually of the super capsule as well. There's one that has finasteride in it, and there's one that has dutasteride in it. Another real important thing about the super capsule is that there are many different reasons why people lose their hair. Testosterone being one of it, but also lack of blood flow is another reason. And a lot of people, especially in the winter times, we don't get enough sunlight. As a result, we don't have enough vitamin D in our body, which is essential for hair growth. So the super capsule is really addressing many different reasons of hair loss, and having it all in one capsule is really a game changer. Um,
There's some questions. A little bit more.
where is that? Oh, perfect. Here we go. Perfect. Great. How long do these treatments have to be taken? So with any hair loss treatment, once you start, you pretty much have to do it forever. Unfortunately, because if you were to stop, then you're going to lose the benefits of those hair growth. And we typically say that you see the results about 4 to 6 months, doing it twice a day daily. And the key is to be consistent. So, I mean, obviously, if you're doing it once a week, it's just not going to help you. You have to do it twice a day, morning and night, routinely every day. The key is consistency. And after that, you pretty much have to do it as long as you want to maintain the hair growth. Um, I've never used any hair loss treatments before. Where do I start? Again, I think the best one to start is with the topicals. The topicals have lower risk of side effects compared to orals, and I think the topical dutasteride is actually a really good place to start. Why is the dermal roller a subscription? Yeah, the reason is because I mean you don't want to you be using this. I mean all the time. I mean, it does get dirty. It gets sometimes blood on it, and there's a risk of infection. So we typically recommend changing on this on a monthly basis. Um, so let's see. I'm just going through the list of questions. Oh, hair loss and age. I want to talk about that one more time. So people could lose hair at any age. Um, there's some patients that actually start losing it in adolescent or like literally 18, 19 years old. Those are always not a good sign. And that's when you want to be proactive about it, because those are the patients that lose hair early are the ones that are more likely to have significant thinning or baldness in their mid to high 30s. So the earlier you start, the better it is. Now, there's some patients that have hair all the way in their 30s and 40s, and around 50s, basically, when they start into menopause, they start to lose some hair. And that's normal just because a lot of the changes in hormones, for example, when you enter menopause, your estrogen goes down, and that could basically lead to like a lot of hair shedding and hair loss. And again, there are many different reasons that people have hair loss, and there are many different types of hair loss as well. So the most common hair loss is male and female pattern hair loss, but there's also autoimmune conditions like alopecia areata. There's also what we call scarring type of hair loss. That sometimes clinically that might be very difficult to distinguish between them all, and this is why having a consultation with a board certified dermatologist is very important and necessary. But I always say if you are losing hair and it's very aggressive, please see a dermatologist that could guide you in the right direction. One, make the appropriate diagnosis, and number two, give you the right medications that you need. So, guys, I think that's all we have for today. Thank you so much for joining us. If you're considering trying a happy head, please use the code AskDrBen60 to get 60% off your first order. Our next MA is on December 12th. Is that correct? Okay, guys, thank you so much to everyone for making this possible. Have a beautiful day and happy holidays. Thank you.